tonight.
Justin started complaining that his head hurt.
He starts crying and says, "Daddy, my head hurts really, really bad."
And he just blacks out.
And he was close to being in a brain death condition.
An ABC 27 special presentation.
She made a sound like she needed help. I called her and she didn't respond.
I could tell very quickly that she was having signs and symptoms of a stroke.
Penn State Hershey Stroke Center presents Stroke Smart, brought to you by Penn State Milton S. Hershey Medical Center.
Good evening, I'm Chuck Rhodes. Years ago, if you had a stroke, more times than not, it was a very disabling, if not fatal. In recent years, the stroke death rate has declined. Stroke is now the 5th leading cause of death in the United States, and previously it was the 3rd. However, each year, approximately 795,000 people suffer a stroke in the U.S., and more than 140,000 people die from it each year. Now,
thanks, Chuck. A Lancaster County boy was leading a normal life until one day he had a headache. That headache took his parents on a roller coaster ride.
Okay, what's your name?
9-year-old Justin Perales was right-handed, but now he uses his left.
Good job.
It's a long story.
Justin lets his mom and dad explain why.
July 13th, 2013, we decided to go up to the State Museum at the Capitol.
We did the full 3 floors, got up to the top. Justin started complaining that his head hurt.
We thought, he didn't eat that morning. He decided not to eat. And we thought it might have been, from hunger or some of that nature.
I got crackers and juice, gave him that, and he just started yelling, it hurts really bad, it hurts, so took him into the bathroom.
And I noticed that the right side isn't moving and is dragging his feet, and my wife is trying to carry him over to the bathroom.
And he just kind of blacks out, so I gotta carry him out of the bathroom. And I go to Eddie. Eddie was coming out of the little cafeteria snack room, and I said, we need to get him to the hospital. He's not responding right now.
Eddie finds the best route and takes him to the nearest hospital.
So I walked in as I was carrying him, and I just said to the receptionist, we need help. He's not responding. He's just limp. They took him in right away.
10 to 15 minutes later, a doctor comes out. He comes back towards me and says, your son had a hemorrhage in the brain. He's bleeding, and Lifeline from Penn State Hershey Children's is coming to pick him up. And I said to myself, I just thought it was a headache.
On his initial presentation to the hospital, he had severe brain swelling and he had a major brain hemorrhage on an examination scale, a very severe brain injury, and he was close to being in a brain death condition. He did not respond a lot to verbal stimulation or painful stimulation. His pupils did not work to light, which is a very ominous sign of a very bad comatose condition. Most of the time, this does not reverse.
Doctor comes and asks questions versus, did he fall on his head? Does he have any prior health conditions?
Did he take some medication that he shouldn't have? It's things that they ask you that make you kind of think, okay, what happened to cause this?
Our initial response was to do an emergency procedure trying to reverse the elevated pressure in the head that he had by securing a tube into the fluid spaces in the brain and try to relieve the pressure. I also explained to them that the reason why he's bled into the brain was from a vessel malformation that he had, which is called an AVM, which stands for arteriovenous malformation. It is basically when a vessel that does not form well, it causes a nidus of entangled vessels with lots of branching of the vessels that has a higher chance of bleeding in the brain. We induced a medical coma and tried to stabilize the pressures in the head so he does not get into a more problematic condition.
And they did tell us that the first 72 hours were going to be critical. They had to keep the pressure and the swelling down in his brain, so that was pretty hard to hear. He had 3 days of just hoping that he pushed through.
I started a Facebook page just to seek prayer for my son's situation, and then it went from 50 to 2,600 people because I couldn't make phone calls to keep in contact with family in the hospital.
It takes 2 long weeks of watching and waiting before doctors can operate and remove the AVM.
We went in after he had his brain swelling under control and his pressures were fine. With the microscope, we were able to remove about a golf ball sized amount of anomalous or abnormal vessels that were involving the superficial and the deep parts of the brain tissue.
The surgery took a lot of hours that day. We were at the waiting room for, I don't know, between 8 to 10 hours probably. Dr. Rizzi comes out and says that we were successful in the surgery.
The very next day, the unthinkable happens. Justin is rushed into the operating room.
He had just gotten out of surgery, so you're already frail, and then to have to go in and do another surgery to get that fixed, that was kind of scary.
It was just a blow to us where we got through this 8 to 10 hour day, and now this next day another vein just burst out of nowhere, and it was becoming a little bit overwhelming at the time.
So we had to take him emergently to the operating room again and evacuate the blood clot, and we found out another small vessel that we had to excise or remove. He did well following that procedure.
Justin spends 5 weeks in the hospital and then goes to Penn State Hershey Rehabilitation Hospital.
We took him over there and he was basically wheelchair bound at the time. The only thing they could move was the left side. He couldn't eat, he couldn't move his hand, the right hand, he couldn't move the right leg, anything. Everything was totally paralyzed on the right side of his body.
He had to relearn pretty much everything. He had to relearn how to talk, how to walk. Anything you do as you learn when you're growing up, he just had to relearn everything.
Speech comes first with some touching words.
I get this voice note and I play it and I hear Justin just, I love you. I love you. And I called Eddie, I said, stop playing with me. I said, how did you do that? Like, how did you get him? He's like, no, that was actually him.
Each day gets better as Justin improves.
We were able to walk within about 2.5 weeks into the therapy program. First time, I think he took maybe about 5-6 steps at the time.
Soon the number of steps increases.
He did therapy and took his first 100 steps. I mean, he went over 100. My husband had him do over 100, but it was like, that was huge for us.
I would have never imagined him to walk or use his limb that well. Seeing him now, miracles can happen. In his case, he did a tremendous recovery.
And the recovery continues at home. Eddie and Addie work around the clock with Justin. They know their son is capable of doing great things.
He just gets me every time when he says, I'm a go with the flow kind of guy, because that's how his personality is. He just goes with it, he runs with it, and I think that's what helped get us to where we're at now.
Sometimes I do catch myself looking at him, and I'm super proud of him because he's come a long way and he's set an example to a lot of people. And there's a lot of people that reach out to me, adults, and they just, your son motivates me. That's the purpose now, to help other people and put other people first.
A remarkable story. Justin is in 2nd grade and his parents say he is doing very well. Chuck, back to you.
Thank you, Deborah. Tough little guy there, and that's always good to hear. Joining us on the set now, the co-director of the Penn State Hershey Stroke Center, Dr. Ray Reichwein and Dr. Kevin Cockcroft. Doctors, I'm going to begin with Dr. Reichwein. We hear the term stroke. What are we talking about? Are there different types of strokes? We lay people use one term. Break that down for us.
So a stroke is defined as a sudden, usually brain problem and a blood vessel abnormality. And there are 2 common stroke types. One is called an ischemic stroke, where the blood vessel is blocked commonly by clot, and the brain supplied by that blood vessel slowly dies over minutes to hours. And the other type is what's called a hemorrhagic stroke, which is where a blood vessel bursts and blood is dispensed in and around the brain.
Is one of those more common than the other?
So the ischemic stroke is the most common, accounting for about 85% of all strokes, and then the hemorrhages account for about 15%.
85%. Dr. Cockcroft, here's a very basic question on a program like this. Do we know what causes strokes?
Well, the different things cause different types of strokes. So for the ischemic strokes, or the blood vessel blockage kind of strokes, the blockage can occur directly in the blood vessel because of disease in the vessel, or it can travel from somewhere else. So a clot can occur in the artery in the neck and travel to the brain, or it can even occur in the heart and travel to the brain. For the hemorrhagic strokes, or bleeding types of strokes, then those are often related to high blood pressure, chronic damage to the blood vessels from high blood pressure over time. And then other things would be blood vessel abnormalities, such as arteriovenous malformations like Justin had, or aneurysms, which are dilatations or bubbles off of the blood vessel.
Dr. Raghavan, we talk about risk factors, and are there some people more at risk just by happenstance, or how does that break down?
So I always say everybody's at risk for a stroke, and even children have strokes. The causes are just different than in adulthood. Most strokes are caused by the common risk factors, and those include high blood pressure, diabetes, high cholesterol, even birth control pill use. Other causes are blockages in the neck or the brain arteries, a bunch of cardiac conditions, and more recently even obstructive sleep apnea is a cause. And then lastly, aneurysms and vascular malformations, as in Justin's case, can be relevant.
Is this genetic? Is this something we worry about, family tree?
So there is a family history component, and there clearly are certain ethnic and racial backgrounds that are more prone to strokes. African Americans have almost double the stroke risk of Caucasians. And within families there are also some genetic syndromes, but in reality many of the common risk factors that we all could develop are still at the forefront of stroke causes.
Well, Dr. Cockroft, we're talking about strokes and symptoms and so on. What do people look for in terms of stroke? What are some of the symptoms?
Yeah, so that's a good question, and that's one of the important things we want to accomplish tonight, is have people recognize these signs and symptoms. So the American Stroke Association and the National Stroke Association came up with this nice acronym called FAST, F-A-S-T. So the F stands for face. You want to look for things like facial weakness. The A stands for arm, so arm weakness, and you can throw leg in there too, leg weakness. And then S for speech. If you have problems getting the words out, if you have problems understanding speech, that can be a sign of a stroke. And then T is for time, and that's to remind you that time is of the utmost importance. The sooner you get to the hospital, the more likely you are to get successful treatment, and the more likely you are to make a good recovery.
Okay, so fast, so we have to remember that.
Yes.
All right.
This is the first question. An article I read said some chiropractic adjustments to your neck can cause a stroke. I know people who go to chiropractors and they've never had a problem. Is there a real danger?
So stroke can be associated with chiropractic adjustments. It is very rare, extremely rare, and it's hard to decipher what came first always. So lots of people can have arterial dissection, which is a tear in their blood vessel, which makes them more prone to a stroke, and we're unsure which came first, the tear or the chiropractic adjustment. But it is extremely rare, and we would not say you could not go to a chiropractor because of this.
Okay, great. Thank you
Thanks.
so much. If the phone lines are busy, and we do know these phone lines are busy, you can email your question to questions@abc27.com. Now, our next story takes us to York County, where a woman went to bed one night and woke up in the hospital. She doesn't remember anything. Her husband fills in the blanks.
Joanne Miller's fingers roll across the keyboard. After playing for 55 years, she's had a lot of practice. And now she practices even more. This time, it's for rehabilitation.
I'm playing the piano every day to get my fingers going. I'm actually doing well. I'm, moving the hand around.
Joanne needs to do this type of exercise. She had a stroke this past January.
I actually don't remember much, but I understand that I had gotten up to go to the bathroom at 3:30 in the morning, and I returned back to my chair because I was sleeping on a chair.
And she made a sound like she needed help, but it wasn't. It was very indistinguishable sound. And I called her, and she didn't respond. And then our friend Ellen, who was staying here to help me, she called her and she said, if you don't answer me, we're going to call the ambulance. And that's what we did. We called the ambulance right away.
So we got a call from EMS, a heads up from the field, saying that we had a patient in her early 60s that was found at home, unresponsive, with a suspected stroke. She had pretty significant neurodeficits. She was not responding to pain. She wasn't following commands. She wasn't moving any of her limbs. Her pupils were not responding. And at that point, we were already getting the telemedicine connected with Hershey Medical Center to have the neurologist evaluate the patient.
Memorial Hospital is one of 14 regional hospitals that is part of Hershey Medical Center's telestroke network called LionNet. It's designed to help local hospitals treat stroke patients.
They brought me back into the ER and they wheeled out a computer, and I was Skyping basically with a doctor, a neurologist at Hershey Medical Center.
So when I first logged on to meet Joanne, I could tell very quickly that she was having signs and symptoms of a stroke. She clearly appeared to have focal neurologic deficits of weakness of one side of her body and speech difficulties. I then looked at the CT scan and found the abnormality consistent with a blood clot involving one of the major brain arteries, and then quickly engaged in a conversation about what we should do next.
And we determined that the patient would be a candidate for TPA.
IVTPA stands for intravenous tissue plasminogen activator. It is a drug that can be used to break up a blood clot. In this case, it's used to treat acute ischemic stroke.
So he said, I'd like to give her a TPA shot. And he said, that works about 25% of the time. That will dissolve the clot. And he said, the other thing I would like to do is start Lifeline down to pick her up. If it doesn't work, I have a surgical team on standby and we'll operate to remove the clot as soon as she gets here. And he said, time is of the essence. I need to know what you want to do. And I said, well, do it.
The drug was given. Lifeline arrived and flew Joanne to Hershey. Meanwhile, Bernie drove 45 long minutes.
As I was driving across the South Bridge, the nurse on Lifeline called me. And it was a call I didn't want to take at the same time, but fortunately, it was really good news.
Joanne's imaging looked extremely good. Her vessel had completely recanalized. There was no longer any evidence of a blood clot in the artery, and her perfusion scan showed that she had completely reperfused that portion of her brain that was at risk.
I can't tell you my feelings then. It was just kind of like overwhelming because, you're worried about the person you love and what's going to happen. And
at first, Joanne couldn't believe how doctors at Memorial Hospital and Hershey Med treated her stroke so quickly.
I was just thrilled. When my husband explained it all to me, I said, oh my gosh, then that really saved me. He said, yes, it did.
I'm convinced that the quick action of those people and people at Hershey saved her life. I think had it not been for that, it would have been a totally different outcome.
She showed a very, very quick improvement over the first couple of days and had returned to probably 90% of her original function quite quickly.
At the beginning, I was just a little shaky and I had trouble speaking a little.
She was able to move her right arm, right hand, her right leg, her right foot.
Over the past several months, Joanne spent time in rehab for physical, occupational, and speech therapy.
I can see the progress. Like I'm getting up and I'm getting dressed, I'm putting on makeup, I'm just being normal again.
She's even starting to boss me around again, so I know she's feeling better.
But I just feel great. I just feel so blessed because I came through this as well as I did.
Joanne is thrilled she can play the piano again. That was very important to her. Chuck?
A story that literally ends on a good note. That's terrific to see her back here playing that again. Dr. Reichwein, talk about the medications used to treat stroke. What's out there now?
So the main medication used to treat the ischemic stroke or the clot-based strokes is the intravenous or IV clot buster TPA, which is what she had received. And it's well known that the earlier you get treated, the more likely you are to have a favorable outcome, and the risk of that treatment is lower. So it has to be emphasized that patients need to get promptly to the hospital to receive that, and it can work, and work nicely in her case if you get there timely.
Okay. Dr. Cockcroft, we talked about the fact that they have the medication. What if they don't work? What other treatments do we have? What other options?
Yeah, so Joanne was very lucky that the medication actually worked, but for those people where it doesn't work, if they have a large blood vessel that's blocked in the brain, then we can actually use catheters to go into the brain and either break up that clot or fish it out with retrieval devices. But again, it's important that the patients come in early. And these techniques are also good for people that can't get the blood clot busting agent. Some people have had previous surgery, some people are on blood thinners, they're not even eligible for the medication. So in those people, the catheter techniques are their first choice.
Can you talk about research? What might be around the corner as far as treating stroke?
Sure. So up until recently, we didn't even know really that these catheter techniques were any better than the drug itself. But since October of last year, we've now had 5 studies that have released their data suggesting that actually if you can get the drug and the catheter procedure, you're going to do much better than if you just get the drug alone. So this has really convinced us now that we need to be more aggressive with these catheter procedures, and again, convince people they need to come to the hospital early to get treated.
Okay, thank you, doctors. And
Ventricular tachycardia. Is my risk for stroke increased?
So no, it's not. The most common irregular heart rhythm is atrial fibrillation, or AFib. It actually increases your risk by 5 times.
Okay, thanks for answering all of our questions this evening. And we also want to thank the specialists as well. Chuck, we'll send it back to you.
thank you, Deborah. I want to ask Dr. Reichwan, we're talking about the Penn State Hershey Stroke Center. What makes this unique? What makes it stand out?
We are one of less than 100 comprehensive stroke centers in the country, and the only one in South Central Pennsylvania. And we also have regional, national, and international stroke experts that provide patient evaluations and care. And we provide the highest level of stroke care across the spectrum of stroke care. So patients and families no longer need to leave our region to get the best state-of-the-art care. We also are very proud of our LionNet telestroke program, so we're now branching out to provide higher level quality stroke care to our entire region.
I'm going to ask Dr. Cockcroft, we talked earlier in the show about risk factors for stroke and so on. What can people do to modify, give themselves a better chance of avoiding a stroke? What can they do?
Well, some things can be very straightforward, such as quitting smoking, taking medication to manage your high blood pressure or diabetes. But sometimes medications and lifestyle changes are not enough, so in those cases there may be procedures that we can do. So for instance, to prevent ischemic strokes, we can do procedures to clean out the carotid artery that may be blocked in the neck. To prevent hemorrhagic strokes, we can treat brain aneurysms before they burst, or brain blood vessel malformations can be removed before they burst to prevent hemorrhagic strokes.
Now here's a question, I can maybe throw it out to both of you. I see you have your pin up here for the LionNet telestroke system, and it's only a couple years old.
That's
that
correct.
Particular thing. You say it's growing very, very quickly. Talk about the pluses for the patient and also for the participating hospital. How does this help everybody involved?
So we currently have 13 telestroke partners out there in all in the perimeter from our hospital system, and we provide stroke expertise and in a timely fashion, and by doing so, we have dramatically increased the outside hospital's IV clot buster or TPA treatment rates, and we've also dramatically decreased how many patients need to be transferred. We only transfer about 20% to our main hospital facility, so the majority of the patients can be treated and do well and stay in their community with our guidance and support.
And just very quickly, do you see people catching on to this quickly?
We do, but not quickly enough, unfortunately. I mean, it's still an issue that people don't realize that the stroke is a brain attack. I mean, it's as important as a heart attack. They need to get medical attention immediately, and that's what we really want to emphasize. If you get in early, you can get treated and have a better chance of a good outcome.
Well, thank you, doctors, again for joining us. We did this last year, and thank you for coming out here this evening.